Hello, everybody. My name is Esmeralda Roman, and the country I was assigned to compare to the United States is the Netherlands. I'm going to start off by talking about main goals and priorities for both of them. So in the Netherlands, the goal is to provide quality care and reduce the number of people uninsured. Only 0.2% of the population in the Netherlands are uninsured. Their priorities are to provide effective, safe, quality, and protective health care. In the United States, their main goal and priority is to provide coverage to the elderly, children, and those who are uninsured. The rate of uninsured people in the United States is 8.5%. As for the organization of the health system in the Netherlands, the government is responsible for setting healthcare priorities, legislative changes, monitoring access quality and costs in the system. They have public health insurance, which is mandatory if you are a resident, which includes services like specialty care, hospital care, maternal care, etc. There's also a private insurance, which is additional to the mandatory insurance, where they receive other benefits not covered with the mandatory insurance. The health insurance in the Netherlands covers all of the residents living there. The insurance is mandatory, which means that if someone does not have insurance, they can be fined. However, it does exclude undocumented immigrants. As for the United States, there are multiple types of insurance in America. Depending on which one people get, typically depend on the service covered and the benefits that come with it. We have Affordable Care Act, Medicare, Medicaid, private insurance, etc. So the different health insurance are intended to cover different people. For example, Medicare is intended to cover people over the age of 65. In the Netherlands, the type of coverage that is provided is maternal care, specialty care, physiotherapy, dental care. However, dental care is only provided up to the age of 18. Mild to moderate mental disorders. Those services that are not covered are cosmetic surgery, vision care, and prevention and social supports. In America, as mentioned, depending what insurance one gets will determine the conditions that are covered/not covered. Medicare includes coverage such as hospice care, nursing care, physician services, rehabilitation. Most of the insurances in the United States do not cover vision or dental. That is additional and separate from healthcare. The money raised for the insurance in the Netherlands are public tax, premiums, tax revenue, and government grants. The primary care providers are the ones who provide most of the healthcare services. They are paid through capitation and FFS, bundled payments, and P4P. The mandatory cost share in the Netherlands is 385 euros, which is about 493 US dollars. They may also pay a voluntary deductible on top of the mandatory insurance to reduce their monthly premium. In the United States, money is raised through federal taxes, state taxes, and sometimes payroll tax if it's an employer insurance. Those who typically provide health services are primary care providers and hospitals, which are paid by capitation and FFS. In the United States, we normally pay a deductible. However, they noted that the average person in the United States pays about $1,846 out of pocket.